teeth? Some people have them. Hopefully. Today we're going to speak to a good friend of mine, Jessica Scott, who happens to also be a dentist.
Yay!
The side of the tooth. Don't saw it.
Tune in and find out how the competition goes. Okay. What would you call a bear with no teeth? Okay, so I'd like to introduce you all to Jess. Jess works at Wessex House Dental Practice in Sherborne, is a fellow ex-Griffin School student.
Yeah, absolutely.
Fantastic, flying the flag for the Griffin School. Jess, is there anything you want to sort of say in your introduction at all?
Yeah, so I, as went to the Griffin School, left in 2009, headed up Bristol University, studied dentistry, and then 2 years later, came back here, back to Dorset, and back in Sherborne, dentist.
Obviously, we're back into lockdown version 3, having all the fun that comes with it. And a few things I think sort of came out of the first couple of lockdowns, obviously dentists closing. I'd like to pick your brains today about sort of a few dentist-related questions, and basically how can we, the general public who use YouTube for guidance nowadays, how can we sort of look after, maintain our teeth and keep them all sort of nice and clean in this kind of lockdown era we're in?
Obviously now with dentists not being sort of as readily available as they were, difficult to sort of get an appointment. So yeah, really kind of keeping on top of your oral hygiene is probably of first most importance. So we all know to sort of brush our teeth twice a day for 2 minutes. That's all kind of like the standard knowledge that everyone has. What I would say is also don't forget to floss or clean in between your teeth, because obviously the toothbrush only reaches 3 surfaces of the teeth. So flossing is really important.
Because I'm not quite sure I would do it right. Is there any sort of, I always end up with massive bleeding gums and look like a vampire that's just eaten. Is there sort of a technique that I need to improve on?
Yeah, so the first thing to say really is if you're getting bleeding gums, don't stop brushing or stop flossing. It just means that you need to brush or floss more. Bleeding gums is just a sign of inflammation. Can be a sign of gum disease, so obviously you want to try and keep the teeth as clean as possible, so don't stop brushing or flossing. Good little trick is to get a really long bit of floss. Don't have a tiny bit, because that's not going to help. Really long bit, wrap it around your fingers, and then you can use it to sort of scrape up and down the tooth. So you want to kind of like scrape the side of the tooth. Don't saw it, because you can cut into the gum. That can hurt. Another good little tip that a lot of people don't realise is spit after you've brushed your teeth. Spit the toothpaste out, but don't rinse your mouth. So you want to keep the toothpaste on the teeth. If you're rinsing off with water or mouthwash after you brush your teeth, you're basically just wasting the toothpaste, money down the drain. So you want to keep it on the teeth. Spit, don't rinse. And so yeah, use a mouthwash at a different time of day. So maybe after lunch or when you get home from work or something like that. The reason being is that mouthwash has fluoride in, but it has a lower concentration of fluoride than toothpaste. So if you're brushing with the high fluoride toothpaste and then you're rinsing it off, you're basically not protecting your teeth as much as you could do. So that's a good little tip. And then really the thing that causes tooth decay and the thing that could cause you to have a hole in your tooth or to cause you pain and actually need to see a dentist is sugar. So everyone knows that sugar is bad for your teeth, can cause tooth decay or cavities. But we're not saying don't eat sugar at all. Obviously that's difficult to do, but just try and save the sugary foods to meal times ideally, so that other foods can help neutralize those sugars in your mouth. So you want to kind of keep the sugary foods to meal times and then just snack on low sugar foods, things like breadsticks. This is the kind of thing that I tell kids to do lots, so like carrot sticks, cucumber, all of those sort of things. Fresh fruit's fine, but things which don't have lots of sugar in, so try and avoid like the cakes, sweets, biscuits, chocolates, those things in between meals, and just keep those to meal times, and that way you can really try and preserve your teeth as they are and avoid tooth decay and cavities.
Now, would that include apples as well? Because apples, I think, have got a bit of a sort of acidity and a bit of sugar in them, sort of natural sugar. Is that sort of one to look to avoid as well, or do you sort of keep that in the whole keeping a sugar until dinner times?
Apples as a whole fruit, as a fresh fruit, I would say is fine. The things that you want to try and avoid is the concentrated fruit juices, so things like actual fruit juices in a bottle. Those things, even if they say no added sugar, they still have natural sugars in them, so they can still cause tooth decay. But I would say things like actual whole fruits, they're not as bad. They still have natural sugars in, but they're not as bad as these sort of artificially added sugars.
Even though the ones that sort of say innocent smoothies definitely aren't so innocent after all.
So yeah, well, see, this is the thing with healthy foods. So a lot of healthy foods have got a lot of sugar in, and they can still cause tooth decay and acid erosion. And fruit smoothies are notorious for that. So even those ones which are healthy, again, you want to kind of keep those to meal times and not sort of sip those throughout the day, ideally, yeah.
If you're in between dentists, you've moved, and obviously the pandemic's been going on now for almost a year, what can you do if you're not associated to a dentist at a particular time?
A lot of NHS dentists are fully booked, so it's kind of difficult to get into one of those. But there are some that are taking on new patients. So the first thing I would try and do is go onto the NHS website and search for your postcode or the area that you live in, and they'll come up with a list of NHS dentists that are taking on patients. Alternatively, find a private dentist to register with. So a lot of practices are mixed, so they do both NHS and private. It's not sort of purely NHS, so a lot of them will be taking on private patients as well. If you're in pain or if you've got an emergency, call 111 and then they'll put you through to an on-call dentist so you can get help and advice, and then maybe they can get you booked in to be seen as an emergency. Have you had an experience like that yourself, Nick, with not being registered with a dentist?
Yeah, last year I had a cavity in one of my teeth at the top jaw at the back, and eating a chewy, I think it's a Malbam or something like that. Other sweets are available, and all of a sudden, it got a little more crunchy than it should have done. So I poured it out, and I had like a whole filling attached, and then sort of the filling took over quite a lot of the tooth, so didn't quite know what to do. Obviously I called 111. Actually no, I didn't. I called the local dentists around Wincanton at the time just to say, help, what can I do? And one did actually recommend going to Boots, and you can buy some like some putty that you can temporarily
temporary filling kits in Boots. They're great. It's been my number one tip over lockdown. Get yourself one of those kits.
I can say it definitely worked. What didn't help was then when I didn't learn my lesson, and I thought, no, I'll go back to eating rubbish again. And within a couple of days, the temporary filling had kind of eroded and left a big hole in my tooth, which then got infected, and then just constant pain. So called 111 again, and they gave me this number for an emergency dentist site in Bridgewater. So I went down there, did a few x-rays, and they said, yeah, that the tooth is highly infected, or the sort of the cavity in the gum up there is going to start causing a problem. But anything they could do that day was take it out.
Oh, gosh.
And this is during lockdown, so there's certain procedures you have to do, obviously you're aware of, where like one patient in, you have to wear a mask, have to sit in the car, you have to sort of almost register in like a temporary area before you get escorted into the surgery. All good fun. So after 4 or 5 injections and like a big kind of drilly, screwy tool, out came the tooth. But I had a nice kind of golf ball sized lump on the side of my face for about 2 weeks or so, just as the swelling eventually went down. And not a great dietary technique.
Yeah.
Lose weight, lose your teeth.
Oh gosh, what an experience you'd have to go through in lockdown as well. Yeah, it's all very different. You might not recognise the dental team when you go back into the surgery. We're all wearing sort of FFP3 masks. It looks like we're about to, I don't know, go fight a fire or board a spaceship or something. The amount of PPE you have to wear nowadays, yeah.
Do you have any sort of dentist myths that you kind of normally get asked when your patients are in the chair, that you kind of the common ones that you could possibly dispel today?
So really, one of the main ones is the bleeding gums one that we've already discussed. If you're brushing correctly, which means putting the toothbrush on the gum line, so where the gum meets the tooth. If you imagine the tooth, you want a nice tight collar of gum around it, and it's on that margin that you've got to be brushing. If you're brushing correctly, then actually within a few days, your gums should stop bleeding. Another one actually, which is interesting, is after you had, I don't know about you, Nick, when do you brush your teeth during the day? Is it morning, night?
I try and brush it to wake up, have a shower, and then brush my teeth before I have anything to eat or drink. And then last thing at night before I go off to bed.
Excellent. The reason for that is after you've eaten something, the sugars in the food, they make your mouth more acidic. So then the pH of your mouth drops to below sort of a critical value, at which point then bacteria can make holes in your teeth. So below that pH, your teeth are more susceptible to cavities and tooth decay. So, and your enamel becomes slightly weaker because it's more susceptible to that. So if you eat and then straight away you brush your teeth, you're actually brushing and can cause abrasion on the soft enamel. You can sort of wear the enamel away. So you want to either eat something and then wait. It takes about half an hour for the pH of your mouth to get back to normal. So you either want to wait half an hour before you brush, or quite rightly, you brush before breakfast, which is what I advise everyone to do. Just wake up, brush your teeth, and then have breakfast after.
And then finally is the no added sugar products. So we've already discussed that, but a lot of people think, oh, they're having a really healthy diet by having all these like no added sugars drinks, smoothies, or even sort of Diet Coke and Diet Fizzy drinks. The Diet Coke and Diet Fizzy drinks are an interesting one because although they don't have any sugar, so they don't cause tooth decay, but they are still quite acidic. So that's when you can get acid erosion on your teeth, and you see quite a lot of maybe teenagers or busy young professionals who don't have much time to take care of their teeth, sort of sipping fizzy drinks all throughout the day. If you love those sort of drinks and you're not going to stop drinking them, a little tip is to drink them through a straw, because then that bypasses your teeth and it doesn't sort of wash around the teeth. Yeah. So drink them through a straw.
Yeah, no, that's okay. So you mentioned a few things that aren't great for our teeth. Is there anything that we can do or eat that it possibly is good for our teeth?
Yeah, absolutely. So my favourite little diet tip is cheese, actually. Cheese is great for the teeth. It's got lots of calcium in, so that helps to strengthen the teeth, but also it helps to neutralise the acids in your mouth. So when you eat the cheese, it's got higher pH, so it increases the pH of the mouth, and that can protect it against tooth decay. So cheese is a really good thing to snack on. And also you can have like a little small bit of cheese at the end of a meal to help increase the pH of the mouth and to prevent tooth decay. So I'd say cheese is great. Chewing gum is really good as well, actually. So like no added sugar, no chewing gum. That stimulates the salivary flow so that it can protect the teeth against decay. And it also has some properties in the chewing gum which can help prevent tooth decay. It's got xylitolin, which is anti-karyogenic, which means that it stops tooth decay. So that's really good.
What is it with dentists and teeth and cheese? Whenever you take a photo, what is it you say?
Say cheese.
Cool. Okay. Well, no, Jess, thank you very much for giving up your morning. Before I let you sort of escape into the weekend, a few jokes I thought might help. You have nervous patients perhaps sitting in the chair. So I hope you're sitting tight, ready for these. You might have even heard some of these. Apologies if you have. And also apologies in general because they're awful. So, what kind of tooth brings you flowers?
I don't know.
A sweet tooth.
Oh, that's nice.
Good one for the kids or maybe the old people. Who knows? They love a good story.
Okay.
And the word was original. Okay. Dentist. What kind of filling would you like? Nick. Chocolate.
Ah, very good.
What would you call a bear with no teeth?
I don't know.
A gummy bear.
Very good.
And last one, what reward would you give a dentist who's given up their morning to help an idiot record a video?
No idea.
You'd give them a little plaque.
Oh, yay!
See,
Oh,
didn't get any better, did they?
they're very good. They're very cheesy jokes.
Hey, and there's cheese again.
Yeah.
Back on the thing. Well, Jess, seriously, thank you very much.
Thank you. Thanks for having me.
If you guys want to follow Jess on Instagram, Jess is down as Dr. Jessica Scott.
Yeah.
So check that one out. Thank you very much.
Thank you.